to observe World Cancer Day on the 4th of February सारी दुनिया में मनाया जाता है, खुशी के साथ नहीं। खुशी उनकी जिन्होंने कैंसर को डिफीट किया, लेकिन मोर इंपॉर्टेंट इज एज ए मेडिकल कम्युनिटी it is our duty to create awareness amongst the population of the newer developments in cancer. And हमारे साथ, it is a matter of great privilege, we have Dr. Imran Khan, who's the medical oncology consultant at the Fortis Okhla Hospital. He is an expert in the management of cancer.
So, good evening to all the healthy and young members, because age is just a number. So today, as Sir has told, 4th of February is celebrated as World Cancer Day. The whole idea is that all people in general should be aware about the cancer risks in general, and if it is diagnosed, it should be diagnosed in an early stage, because earlier stage has a higher chance of recovery as compared to later stage. Even in patients who are diagnosed in late stage, we have got newer advanced in treatment like targeted therapy, immunotherapy, drug conjugate therapy, CAR T cell therapy, where treatment has been remarkably well as compared to the past time. So with that good aim, we'll start our this discussion for the day. So who is practically old? There are different definitions. As per United Nations, they have kept it at 60 years. Our one Society of Geriatric Oncology has kept it 70 years. As again, Oncological Society has kept 65 years. So about 60 to 65 years of age is considered as per the definitions.
Dr. Imran, your voice is... आपकी आवाज थोड़ी कम हो रही है.
Net. Okay. I will change my location, sir. There is some net issues.
अच्छा, okay.
2 minutes. Hello, sir.
Yeah.
Hello.
Yes, please go ahead.
Now the voice is clear, sir. So, as we have discussed, age is just a number. So, practically, about 60 to 65 years by definition is considered as an old age. So, why aging population is concerned for healthcare? Because percentage of population who will be around 65 years is predicted to be double by 2050. So, it will be 10% in the year 2023, and it's going to double. And in our country, 1/4 of the patients who are diagnosed per se with cancer are 65 years. So, cancer and elderly age, these are both a big problem. As per this graph is again showing the same thing, that our cancer risk and the projection of population above 60 years is going to get doubled from 20.8 and is going to be 36.1 in by the end of the century. Next slide. So average life expectancy has increased in all countries. If we compare with other Western countries like USA, Switzerland, and Italy, our Indian population is also increased. The average expectancy of life today is around 72 years. Next slide. Sir, इसमें ना एक बार फिर से yes. So how is aging and cancer related? So the projection is 2012 में 14 million cases थे और 2035 में ये around double हो जाएंगे. Although we don't know the exact cause, but it can be because of multiple factors like advances in modern medicine, increase in life expectancy, change in environmental condition, and dietary adoption and working culture. So all the factors are coming in and they are increasing the risk for cancer, besides the advanced age. So age greater than 65 years, if you take other factors, अगर हम बाकी सारे factors को निकाल भी देते हैं, above 65 years of age, in itself is an independent risk factor for cancer. It is not to be taken as a pessimistic thing. age above 65 years means that we have to be more proactive. We have to adopt more health lifestyle. Our screening for cancer should be more in a regular fashion, and our regular health checkup should be there. So it is a factor that is non-modifiable. Now let us discuss with some important cancers that are we face in elderly population. These cancers are listed as per the Indian population. So we've got head and neck cancer, breast, cervix, and prostate cancer. Next, next is इसमें click कीजिए. So if you look at the head and neck cancer, the typical symptoms are lump in the mouth, face, neck, or throat, a sore throat that doesn't go away, or a trouble or pain when swallowing. Next, or a change of hoarseness in voice, a sore or a growth in the mouth, or persistent earache. Next slide. Main risk factors we know it is the tobacco smoking, and second is the alcohol. Next, next, next. So besides these two common risk factors that contribute 90%, we have got other factors like infection with human papilloma virus, for which we have a vaccine available. There are other contributory factors which are mostly non-healthy, like a diet that is low in fruits and vegetables, or a diet high in salt, diagnosis of some inflammatory conditions or some genetic conditions that predispose to head and neck cancers. But per se, alcohol and smoking contribute 90% causes. The rest of the 10% causes, we have to search for these risk factors. Next. So prevention, we should totally stop smoking. We should avoid alcohol, as has been said, like one drink for female maximum and two drinks for male. Eat a well-balanced diet, use sunscreen regularly to prevent sun-related cancers like melanoma, and have a protected sex for young age group, and vaccination, which is not yet unfortunately prevalent in India, but it should be there. It prevents with HPV-related oral cancers and maintain good oral hygiene. Next. So next cancer is the cervical cancer. It is predominantly caused in 90% cases by human papillomavirus infection. It is a disease that occurs more in younger age group with infection like HIV, chlamydia infection, who use long-term oral contraceptives, who have multiple full-term pregnancies, or a pregnancy at a young age, less than 18 years, or low economic status. तो अगर इनमें हम देख लें बहुत सारे factors like multiple pregnancies, low economic status, not good oral hygiene that have been there. So that is why cervical cancer is the second most common cancer in females in India. Next. So symptoms are like vaginal discharge, pelvic pain, flank pain, bleeding with urine, urinary incontinence, constipation, weight loss, or decrease in appetite. Next. So who should be taken as high risk? A woman whose marriage has been at the age of less than 18 years, women with 5 children or more, a patient with HPV, HIV infection, or long-term oral contraceptives, smoking, or high-risk behaviors, they are all risk factors for cervical cancer. Next. So screening is a very important part for, so there's a different age group. Less than 21 years, we go for screening. By 21 to 29 years, the screening is more important, perhaps every 3 years. And from 30 to 65 years, we do a 5-yearly test of pap smear and HPV testing. And after 65 years, we can discontinue the screening because after that, the risk of developing cervical cancer is less. But patients who are immunosuppressant, they should continue screening for this. And a patient who has done total hysterectomy, who can avoid this cervical screening. Next slide. Breast cancer, again, it is the top most cancer in general, and in females, it is the number one cancer. So the symptoms, as we know, the breast swelling, discharge, or plucking of the skin, these are the main symptoms. Next slide, sir. Next slide. So 5 to 10% cases, the cancer is genetic, and the risk factor increases if there is anybody in the family. 1.5 to 3-fold increases. So we have to assess the risk of cancer, how many relatives are with the breast cancer, the degree of relationship, first degree, second degree, and if the age of diagnosis is less than 40 years, and number of unaffected relatives. Next slide. So again, 5 to 10%. I think it is the same slide. Next slide. So these are important genes which cause breast cancer. These are the BRCA1 and BRCA2 genes. they are basically DNA repair genes. Besides this, we have got certain other genes like Leaf-Moni, COD, CDH1, PALB2. So by just enumerating these genes doesn't mean they don't occur. They occur. They occur in 5 to 10% case, and daily in our OPD we discover a new patient with this gene being positive with breast cancer. Next. So there's a definite role of amount of hormones that are in the body and with the breast cancer. So early age of menarche and late age of diagnosis, late age of menopause, they are the main risk factors of developing breast cancer. So the amount of estrogen that remains in the body that increases the risk for breast cancers. And a breastfeeding that remains for at least 6 months it has been found to be a preventive for breast cancer. Next, similarly, next is obesity. It increases the risk. It increases the risk. So weight gain has been a definite risk factor for breast cancer. And lastly, we'll discuss about the prostate cancer. Next slide. So prostate cancer increases with the age of above 50. Family history has a high risk. So in certain races like black men, they have high risk. Certain genes are involved that can increase the risk of prostate cancer. So does obesity or a diet that is high in food, high in fat or sometimes calcium, they have said. But these are some additional risk factors. Main risk factor are the age and the family history. Next slide. So any uh, male patient above age of 50 years, he should do a serum PSA at 6 monthly intervals because the value of PSA, if it is goes greater than 10, the risk of developing cancer goes as high as 50%. But it doesn't mean that all patients will have breast cancer, just prostate cancer as a diagnosis. Only thing is that we should be like precautious about these things, and a value of higher, we should go for additional investigations to rule out the cancer. Next slide, sir. So, in general, maintain a healthy weight, eat a healthy diet. That should be more with fruits, vegetables, whole grains. Limit red meat, limit processed food and dairy foods. Reduce fat intake. Take fat that are high in omega 3, omega 6 fatty acids like fish, nuts, and seeds. And eat cruciferous vegetables like broccoli, cauliflower. These are important. Exercise should be done regularly, at least 150 minutes of exercise for a week. That goes 30 minutes per day. It should be good, and alcohol should be reduced. Alcohol should be limited, and smoking should be abandoned as a whole. And for prostate cancer, specifically above the age of 50, we should do regular yearly or 6 monthly screening with serum PS. Next slide, sir. So thank you. Please.
जो मोस्ट सिग्निफिकेंट लाइन डॉक्टर इमरान ने कही, एल्डरली एज इटसेल्फ इज अ रिस्क फॉर कैंसर, तो इसको उन्होंने कहा डिस्क्रिमिनेटरी मत समझिए, बुरा मत मानिए इस बात को सुन के, बट द फैक्ट इज दैट एज वी ग्रो वी आर सीइंग मोर केसेस ऑफ कैंसर. बट दो बातें, मेल्स में माउथ कैंसर एंड प्रोस्टेट कैंसर, and females may mouth cancer also in females, Dr. Imran. Females are also showing signs of mouth cancer because a lot of females are now having tobacco chew. And cervical cancer, confused ना है, मुझे किसी ने क्वेश्चन भी डाला है, cervix is a part of the uterus. बच्चेदानी का वो हिस्सा जो वजाइना के अंदर आता है उसको cervix कहा जाता है. उसका कैंसर फीमेल्स में ज्यादा पाया जाता है. लेकिन डॉक्टर इमरान, जस्ट फॉर क्लैरिफिकेशन, आपने कहा आफ्टर द एज ऑफ 70 सर्वाइकल कैंसर नहीं होता फीमेल्स.
Sir, after the age of 70, screening has not much role.
स्क्रीनिंग नॉट, बट कैंसर तो फिर भी हो सकता है.
Cancer.
जी. So I think what is understood, prostate and mouth cancer and cervical cancer and mouth cancer in females and breast cancer. ब्रेस्ट कैंसर डॉक्टर इमरान मेल्स में भी होता है कि नहीं होता?
So males में भी होता है. Out of every 100 cases, 1 case is male breast cancer.
Male cancer. So impossible नहीं है for a male to have breast cancer. So what is important is screening, screening, screening. क्योंकि आप रिस्क पे हैं. So Dr. Imran, just in 2 lines, if we have a 75-year-old gentleman and a 75-year-old lady, What test would you tell a 75-year-old male what test he should get done to look after high risk cancers?
Sir, for male, if he's a smoker, at 75, at 75, he should at least. So there is no actually what has happened that there are different recommendations have been there. If he had been an active smoker, he has to do a low dose CT scan of the chest. The
Test.
same
Okay.
CT scan that you used to do during Corona. That has
That
been
is
added
one.
up. And
That,
depending upon it, we don't do as a whole, like for endoscopy, there's a cutoff like every 5 years, colonoscopy every 10 years. So these are not a regular test, the NEC ones. But blood tests, they should be done. And depending upon his symptom, we chart out his test. Like
plan.
अगर किसी को abdominal pain वगैरह है, अल्ट्रासाउंड करवा ही लेंगे. अगर ब्लीडिंग पी आ रहा है तो एटलीस्ट सिग्मोइडोस्कोपी तो करवा ही लेंगे कि
Right.
देखेंगे कि वहां पर कितना है तो नहीं. So it goes like that. This is the females maybe besides the traditional test, hemogram and X-ray, depending upon her symptoms. अगर breast का कोई swelling लग रहा है जो कि होता है 75 में भी, तो उसके हिसाब से मैमोग्राम तो करवाएंगे उनका अगर मतलब दिख रहा है या कुछ सस्पिशन है. बिकॉज इट इज नॉट एवरी टाइम कि आपको कैंसर ही दिखेगा. देयर मे बी नॉन कैंसरस benign conditions can be there,
Benign
but
condition.
at least all we tailor it as per the symptomatology of the patient. It's a basically a generalized thing कि मतलब कौन से टेस्ट करवाने चाहिए.
That's
एटलीस्ट कोलॉन स्क्रीनिंग 10 साल में एक बार करानी चाहिए. प्रोस्टेट में एक 6 या 1 मंथली 1 ईयरली इस तरह पे कराना चाहिए. और लोडो सीटी अगर पेशेंट एक्टिव स्मोकर है या स्मोकर रह चुका है उसके लिए कराना
right.
चाहिए एज ऑफ 75. बिकॉज स्क्रीनिंग हैज ए बिगिनिंग एंड स्क्रीनिंग हैज एन एंड. by and large by 70 to 75 years the screening as a whole will stop, because after that the longevity is not that, because screening जो methodology है, that all depends upon the what is the cost benefit ratio also. Like आप
Okay.
patients 75 में how many patients in general population, it is not specific to that, in general population कितने patient में ये test करके हमें yield मिल रहा है, वो number हमें attain करके एक recommendation बनानी पड़ती है. By and large by 75 years we stop screening per se, but it is for healthy people. If patient has some symptoms, then we have to follow specific abdominal symptoms, so abdominal related bleeding PR, that symptom, swelling somewhere, we have to evaluate that with basic radiology. और एक इम्पोर्टेंट चीज है जो सर आपने पिछली बार भी कहा था कि FNAC का बहुत ही प्रेवलेंस है, जो कि टेस्ट हमने अबेंडन किया है ऑन्कोलॉजी में. because it doesn't
Abandoned.
give us correct. The only test is to go a core biopsy or a true cut biopsy, because that gives us a proper architecture. इवन पेशेंट का अगर कैंसर होता भी है, डिटेक्शन है, वो किस टाइप का है, उसको फर्दर टेस्टिंग के हिसाब से इट गिव्स अस बिगर नॉलेज. एंड इन
Okay.
nowadays we have got advances in treatment. अगर कोई जेनेटिक टेस्ट वगैरह, नेक्स्ट जनरेशन सीक्वेंसिंग करके टेस्ट है, वो सारे टेस्ट हम तभी कर पाते हैं व्हेन यू हैव एन एडिक्वेसी ऑफ टिश्यू, जो वैसा रहेगा सर.
Then that is better. That is. So I think
सर
very important information कि अक्सर हम कहते हैं FNAC एज के मुताबिक आपकी टेस्टिंग बदल जाएगी. सो प्लीज रिमेंबर एक मेथड नहीं है. इट इज टू बी टेलर मेड फॉर एवरी इंडिविजुअल. ये स्मोकर रहा है कि नहीं रहा, इसको पहले खांसी रहती है कि नहीं रहती. सो देयरफॉर डॉक्टर इमरान, जब आप कह रहे हैं 75 ईयर्स के बाद स्क्रीनिंग का रोल कम हो जाता है, तो
सर
75 ईयर्स के बाद क्या कैंसर के भी केसेस कम हो जाते हैं?
yes sir, 75 के around then cancers they have a decreasing trend after that.
डिक्रीजिंग
By
ट्रेंड.
60-65 एक ग्राफ थोड़ा ऊपर लगता है. By 75 they go down.
एंड
That
व्हाट आर द कैंसर्स व्हिच आर सीन बियॉन्ड 70 75 और 80 ईयर्स ऑफ एज?
by name we cannot say, but मतलब age per se, any
एज.
cancer can happen, any cancer,
तो
like even
नाउ
जैसे
नाउ
जैसे जैसे सर कोई pediatric cancer है, blood cancer,
जी.
वो जो कि बच्चों में ज्यादा कॉमन होता है, बट elderly age में भी it becomes a risk factor. like बच्चों में ALL होता है, elderly में AML होता है. The only
ओके.
difference is that, लेकिन होने के लिए ALL भी हो सकता है
हो सकता
per
है.
se, barring any any this cancer type. Cancers in general or do happen in elderly age. But
एल्डरली.
if patient has cost past this 75 to 80 years, if you say elderly, we call them very elderly. So
जी.
then the prevalence it starts to decreasing. But that doesn't
Start.
mean कि patient but that doesn't mean कि patient को,
नहीं
if
हो
the
सकता.
patient develops certain symptoms, he can definitely.
सो आई
मतलब
थिंक
we discuss these things.
in by and large, elders are at risk, but the elders type of cancer slightly change, and the screening method goes, screening का मतलब होता है 20 लोगों का इकट्ठा कराइए. Elders में ऐसा नहीं होता. Elders में screening has to be individually designed. So therefore, those designing of screening is individualized. Now, for example, Mr. Markin has asked, can constipation be a prospective reason for colon cancer?
Yes. Constipation is a symptom. Constipation is a symptom for colon cancer. So we can divide this. Why is patient having constipation? That can be, but it doesn't constipation and it can cause cancer. It is like we have to discuss like constipation है तो fecal material वहाँ पर बहुत time colon में रहता है कि इस वजह से inflammation वगैरह होती है and it further develops into cancer. That is a point of research that we don't know. But constipation, if a patient is having constipation,
I think more
that means they are
importantly,
unexplained.
more importantly, Mr. Markin and for everybody, Dr. Imran would agree कि आपकी जो changing habits of bowel, तो पहले अगर हर रोज आता था और अब चौथे दिन आना शुरू हो गया, या हर रोज आता था और अब दिन में 10 बार मोशन पास कर रहे हैं, चेंजिंग पैटर्न ऑफ बाउल हैबिट्स शुड रेज सस्पिशन. अगर किसी को लॉन्ग स्टैंडिंग स्टूल्स पास नहीं हो रहे, वो अलग बात है. 4 साल से मेरे को पेट साफ नहीं हुआ, डॉक्टर इमरान, उसकी कोई वैल्यू नहीं है. हाँ, मुझे 6 महीने में बदलाव आया है. दैट इज मोर इंपॉर्टेंट probably.
Sir, I will add one thing. It is not, we just don't go with one symptom only. If a patient has a change in bowel habits, या तो constipation है या lose motion है, because of that उसका appetite में भी change आता है. तो appetite की change की वजह से उसका weight में भी change आएगा. So there is a constitutional symptoms that we match, and we see कि like कुछ तो है कि मतलब it is unexplained, and it looks like it is a sinister thing क्योंकि उसका weight भी अब reduce हो रहा है. So we then it becomes an alarm in our sign, and we start investigation. But that doesn't mean that every time we'll get a cancer. It's a per se cancer is a rare diagnosis still as compared to other diagnoses. Although the cure rate of other things have increased, that's why the percentage of cancer जो bulk का भी ज़्यादा बढ़ रहा है, research हो रही है. It's a rare disease, but it is a dreadful disease per se. We have to be very cautious.
And secondly, Dr. Imran, not only being dreadful, the newer changes जो इलाज में आया है, उसका result इतना अच्छा आया है that it is encouraging for us to treat cancers. Malti ji, your question is very intriguing. Is there any way to avoid interventionist investigations like endoscopy and colonoscopy? Yes, Dr. Imran, what is your view?
Yes. So a patient who has done a colonoscopy at the age of 60 years and has come as normal, next, if it is normal, so next colonoscopy date will be at 70 years.
70 years. That's exactly what we are saying. So colonoscopy, once normal, should be done at 60 because we are missing out on simple issues like polyps. And bleeding polyps is a leading cause for anemia in the elders. So colonoscopy is not just only done for cancer, it is done for varying other small benign conditions which are picked up. So one colonoscopy and then normal 10 years later. That's it. But you can't imagine the number of people we can pick up. Mr. Mehra says that fluticasone and solmetrol inhalation daily, are there any risks probably for cancer, he's asking. Fluticasone and means the inhalers that people take.
No, there is no scientific proof
there is
of
no history. There is no
but naturally, you are taking this, whoever is taking this inhalation, they are taking for something like asthma or something. It is to be taken. You cannot avoid those things.
And
it is to be screening as a part of screening, endoscopy every 5 years for stomach cancer.
Stomach cancers.
Stomach cancer, esophageal and stomach cancer are separate, and colon cancer is a separate thing.
So endoscopy, does it cover the stomach or does it cover the upper GI only?
Upper GI endoscopy. We call it upper. We normally, commonly we tell upper GI endoscopy and lower GI endoscopy. Upper GI EGD, endoscopy, EGD we call it upper GI, and colonoscopy is the colon part of it.
And let me clarify, either of these procedures are non-invasive. They are not invasive. Invasive is considered when we put a dye or an injectable, or we do something. Those are invasive procedures. Like examining of the nose by an endoscope, it's a non-invasive procedure. So all scopies are non-invasive because they are only external and as a routine. But anyway, the cancer, what is important, Dr. Imran, I want to stress on this. Having been detected for a cancer as an elderly, what are the prospects under the present modern day regimes of treatment of cancers?
So actually, we're celebrating in Fortis, Okhla, the same thing. The conventional thing about treatment part of cancer was surgery, radiation therapy, and chemotherapy.
That's
But
right.
what has happened in the last 20 years that there has been an advent of targeted therapy. For past 8 years, there is an advent of immunotherapy, and there is one more form of treatment by the name of antibody drug conjugate therapy. And there are more treatment options like CAR T cell therapy, BITE therapy, bispecific therapy. These are all the form of therapies where we are exploring how this cancer cell basically grows, and we are exploring and manipulating the mechanism, trying to defeat this cancer cell to further divide.
Good.
And out of this, we have been able to we have won in many fronts. For example, a patient with stage 4 lung cancer, and he is having a mutation by the name of ALK. And if that mutation comes positive, he has to just take a single tablet, just like a hypertension or diabetes patient takes. He has to take that single tablet daily, and there is, I think, minimal side effects with that tablet. I had a
Wow.
patient of the age of 85 years, and at 85, he was diagnosed with case of stage 4 lung cancer. Luckily for him, he was L positive. He was not fit for any chemotherapy. Till now, he is on tablet and he is doing fairly well. Even he
Wow.
misses sometimes
Wow.
that tablet. I'm saying
That is
because of his
the
age and
beauty.
sometimes the patient as well. So the
I think that is the
currently for
highlight of the
majority of
day.
yes,
Yeah,
and
that is the highlight of the day. That
similarly,
today, a simple tablet. G. Please go ahead, Dr. Imran.
these are the
G.
targeted
Imran,
tablets.
Dr. Yeah.
We have got immunotherapy. That's a very mild form of treatment. It doesn't cause major side effect. It is for a patient who has been diagnosed with cancer. So the immunotherapy that was initially used for advanced stage cancers, the results have been so profoundly satisfying that now in earlier stage of cancers, also research is going on where we're combining the immunotherapy with surgery, with radiation therapy before giving surgery, so that the results, say we have a result of having a good outcome 90%. We don't want now 90%, we want 95%. So the research is going at very
95.
high
Wow.
rate, and we are hoping by
Very high.
the end of 2040 to 2050, majority of cancer patients will be it will be just like a chronic disease, just
Wow.
like hypertension, just like diabetes. It will be there. It is just matter of time.
Right.
As an
So I think
example, sir,
the most
there's
important
a
message,
blood cancer by the name of
the most
yes.
important
So
message what we
there
are
was a
getting
condition.
is that early detection and very good modalities of simplified treatment for cancer is available with very good results. Yes, Madhuri, how to diagnose cancer, but he's also told us the great results that are coming out with the newer types of treatment. Imagine lung cancer stage 4 being treated with one tablet. So that वो जो पिक्चर आती है ना किसी के दिमाग में कि कैंसर का इलाज हो गया बाल उठ जाएंगे बीमार पड़ जाएगा उल्टियां आती हैं that all has changed, Dr. Imran.
They are not of any value for diagnosis. They are of only value when we have got a diagnosis of cancer from biopsy. Like a patient is a diagnosed case, then we'll do tumor markers to see the response of the treatment, to see whether he is doing well or not. Per se, if a patient is a higher value of CA19-9, it doesn't mean he has a cancer because it is not CA19-9, CA125. These are not organ specific. CA125, it doesn't mean CA ovary is there. There are a lot number of causes like endometriosis, some ovarian cystic disease, or even in lung cancer. Sometimes these are non-specific markers. They have their value only for seeing them in monitoring, I can say, and they are no
Prognosis.
value in evaluation except for serum PSA we do, and that serum PSA because we don't want to do an invasive sort of a thing, prostate biopsy.
जी
If the
साथी
PSA
साहब
level goes higher than a normal range, Hello.
Please go ahead.
Only for serum PSA, as per American Urological Association, they have kept that it should be done regularly 6 monthly to one year, 6 months to 1
But
yearly.
I think
And then if it
Dr.
shows
Imran has
increasing
clarified,
trend,
pehle we used to have a lot of importance on CA 125, etc. So, Dr. Imran, what you are saying, these days we don't have so much of prominence of the blood values of cancer markers.
look, a patient is having a say 125, say 100, it is
Ji,
there, and the normal value is 35. And we
ji,
have done, it doesn't have any value. We have to investigate the patient, do his scanning, CT scanning, ultrasound, followed by CT scan. If there is something in her ovary region, adnexal, some growth is there,
then
some
you will,
lesion is there, then it has some value. Otherwise, it is
Otherwise.
nothing. It doesn't have any value.
Ji, Sani Sahab, your question.